Hi, my name is Aaron Munns. I'm the Veterans Director at the Veterans Asbestos Claims Assistance Center at asbestos.com. Today, we're going to be talking for veterans how to get screened and diagnosed with an asbestos-related lung disease. I've been the Veterans Director here at this center since 2015. In that time, I've spoken to over 3,000 veterans. I served in the Army for over 9 years on active duty myself, and I have never met a veteran or spoken to a veteran who has not had some exposure to asbestos during their service. Now, about 20% of veterans who have had a lot of exposure to asbestos will develop an asbestos related illness as a result. 80% will not. Hopefully, you are in that 80% that never has a negative health outcome as a result of your service and exposure to asbestos. But if you are having symptoms, or even if you're not, if you served over 20 years ago and were exposed to asbestos, we recommend speaking with your doctor and having some preliminary screening so you can find out if your exposure to asbestos may be impacting your health and figure out if you may qualify for VA disability benefits, healthcare, and other civilian resources. For VA disability claims for asbestos, you must have a valid diagnosis of a condition that the VA recognizes can be caused by asbestos, and you have to have a nexus statement from your doctor. A nexus statement is a letter from your doctor that states that, in their professional opinion, they believe that your current diagnosis may have been caused by a particular or specific exposure to a toxin, in this case, asbestos. So, what that translates to is that, in their professional opinion, there is a 50% chance or greater, it is at least as likely as not, that your current diagnosis of pulmonary fibrosis, lung cancer, bladder cancer may be caused by exposure to asbestos. So they don't have to be 100% sure. They don't have to say that it is the only cause of your current diagnosis, but they have to say that asbestos is a contributing cause, in their opinion, to your current diagnosis. You also have to be able to prove that the majority of your exposure to asbestos occurred on active duty. As I mentioned previously, every veteran that I've ever spoken to has had some exposure to asbestos. Many veterans continue to have exposure to asbestos in their civilian work, either before or after service. So you just have to provide some information about how, when, and where you were exposed to convince the VA that the majority of your exposure was on active duty. Now, the PACT Act that you've probably all heard of passed in 2022. It does not mention the word asbestos a single time. A lot of veterans have confusion about presumptive conditions. Presumptive conditions are conditions that, if you're diagnosed with and have served in a particular location during a particular time and were exposed to a toxin, the VA presumes that that diagnosis was caused by your exposure at that time and that exposure to that toxin. So you do not have to prove the medical connection. The VA presumes it. It is a presumptive condition. There is nothing presumptive about asbestos exposure for non-PACT Act asbestos claims. So the PACT Act covers several different periods. It covers Agent Orange exposure during Vietnam and some other areas. It covers the contaminated water at Camp Lejeune. It covers ionizing radiation in nuclear tests and cleanup and accidents, and it covers burn pit exposure for Gulf War veterans and veterans who served overseas in the global war on terror, specifically in Southwest Asia. If you served in another location or at another time, even if you're diagnosed with one of the conditions that's on that list, your condition is not presumptive because you did not have exposure to that particular toxin during that particular time. So for you, for asbestos, you would file a direct service connection claim where you provide the diagnosis, the medical nexus statement from your doctor, and an asbestos exposure summary where you demonstrate that the majority of your exposure to asbestos occurred on active duty. The first step is the diagnosis. The conditions that the VA recognizes may be caused by asbestos are primarily lung conditions. When asbestos fibers are disturbed through maintenance, demolition, repairs, or wear and tear, where an asbestos containing material breaks down and releases dust into the air, the most common method is that you breathe those fibers in, they go through your airways and get embedded in lung tissue. You can also swallow those fibers and they get into your digestive tract and urinary tract. When asbestos enters your body, it causes inflammation, and your body recognizes those fibers as a foreign body and produces scar tissue or calcified tissue around those fibers. Over time, that scar tissue can replace healthy tissue and cause lung diseases where healthy lung tissue is replaced by scar tissue, and you no longer have the ability to exchange oxygen and carbon dioxide in those areas of your lung. This can cause interstitial pulmonary fibrosis or asbestosis, pleural effusion, which is fluid buildup in the space outside the lungs between the lungs and the rib cage and the diaphragm, and pleural fibrosis, scarring of the pleural lining surrounding the lungs. It can also cause pleural plaque, which is calcified, harder patches of tissue in that pleural lining. Mesothelioma cancer of the pleura, of the pleural lining, a very aggressive and rare cancer that is only caused by asbestos, as well as mesothelioma cancer of the peritoneum, which is the lining surrounding the abdominal organs. Also rare and aggressive cancer caused by asbestos. The VA also recognizes that asbestos exposure can cause lung cancer, cancers of the bronchus, gastrointestinal tract, larynx, pharynx, and the urogenital system, except the prostate. Now, this is in the May 2025 update of the M21-1, which covers diseases caused by exposure to asbestos. It's also worth noting that anyone who has an asbestos lung disease will likely have reduced lung capacity over time and lung function. Reduced lung function sends less oxygen to the heart and creates added stress on the heart. This can cause a heart disease secondary to a lung disease. This is called cor pulmonale, and this can include pulmonary hypertension or failure of the right ventricles of the lung. Some of the symptoms of asbestos lung disease, which again is the most common disease caused by asbestos, are chest pain and tightness, shortness of breath, fatigue, a persistent dry cough that's an unproductive cough that does not produce phlegm, clubbing of fingers and toes, which is caused by reduced oxygen getting to the extremities, crackling sound when you're breathing, and a loss of weight or appetite. Typically, doctors will do a chest x-ray first. You can see on this slide that the image on the left is a chest x-ray. Chest x-rays are good in identifying if there is some initial scarring, if there is a collapsed lung, if there is fluid buildup either in the lungs or outside the lungs, but they are not as accurate as diagnosing early stages of pulmonary fibrosis, pleural plaques, pleural thickening. A CT scan is much better at that. And you can see an image from a cross section of a CT scan of the chest and lungs. Like I mentioned, every veteran had exposure to toxins, including asbestos. If you're not already enrolled in the VA Healthcare Administration, you can enroll online on va.gov or connect with your county veteran service officer to help you enroll. You can, once you're enrolled, you'll have a toxic exposure screening, a terror screening. If you've already enrolled in the VA and have not had a terror screening, the VA is supposed to do one of those every 5 years. You'll speak to a doctor and go over all of your duty assignments and the possible toxins that you were exposed to, and then they can order some tests to see if those toxins may have may be contributing to your health issues. For asbestos, we want you to have a CT scan. Typically a low dose CT scan, and there's a CT scan machine on this photo. You lay down, you go through a tube like a donut. It's a pretty quick and non-invasive procedure, and it's able to identify the soft tissue abnormalities, scar tissue, fibrosis, and it also can detect if there's any cancers. As part of this, we also want you to have a pulmonary function test, which measures your lung capacity. If they suspect that you have a cancer, if you've had significant weight loss, if they've done some blood tests that show elevated blood cell counts or an infection, we want you to have that PET scan, and based on the PET scan results, they may request for you to have a biopsy. If you are a suspected cancer, the tissue biopsy will determine the cell type of the cancer, which will give your doctor information about how best to treat it. For mesothelioma cancer, again, that very rare and aggressive cancer, there's only about 2,500 diagnoses a year, but veterans make up about 30% of the diagnoses, and that's because of how much asbestos was used in the military, especially on Navy ships and Coast Guard cutters. But it was also used in every wheeled vehicle before the early 1980s in the brake pads and clutch faces. It was used on helicopters, fixed wing aircraft, armored vehicles. If you served and worked on vehicles or equipment that contained asbestos, you are at higher risk for developing mesothelioma. The initial scan of the CT scan can see if there is the early stages of mesothelioma cancer. If you are diagnosed with mesothelioma cancer, you can file for VA disability. You're also eligible for civilian compensation if the diagnosis has occurred within the time limit for the state that you live in, the statute of limitations. We can help you connect to legal compensation if you're eligible. We're not an attorney. I'm not a lawyer or law firm, but we do have connections based on our experience with the best firms in the country, based on where you live, what branch of service you were in, how you were exposed to asbestos, if you had civilian exposure in addition to your military exposure, and we can help make that recommendation for you. Just contact us. If you are diagnosed with an asbestos-related disease, we can help develop the evidence to file a VA disability claim. If you are not already connected with your county veteran service officer or a service officer from a volunteer service organization like the VFW or DAV, we can help you make that connection for you. If you need information about how to get the right diagnosis, how to connect to a doctor, and how to prove your military exposure to asbestos, you can contact me. My email is aaron@asbestos.com. You can also call me at 888-327-8271. We have other YouTube videos available that cover asbestos exposure summaries, nexus letters, how to prove your case to the VA, how to avoid common mistakes. Please let me know if we may be able to help.